I'm Carolina.
And I'm Rebecca.
And welcome to the podcast, And Then They Wondered, where we will be talking about things that we wonder about, maybe you wonder about, and things that everyone maybe should wonder about.
Exactly. And in this season of the podcast, we're talking about hospice care, end of life, having some really, really great conversations around a topic that a lot of people don't talk about until it's too late.
Right.
So we're really excited about this season, and we hope you'll join us. Where can they find us?
You can find us on all social media platforms, Facebook, Instagram, TikTok. You can also tune in to listen to us on YouTube, Spotify, and Apple Tunes?
Apple Podcasts?
Apple Podcasts.
I like it. I handled that part. You're good.
Okay.
We will see you on any of those platforms, and be sure to like and subscribe so you don't miss an episode. And then they wonder. Hey everyone, and welcome to And Then They Wondered. I'm Rebecca.
And I'm Carolina.
And we're so glad you're here.
Seriously, though.
Yes, we're glad you showed up. Thanks for listening.
This is our first episode of our first season ever. And so for the next 7 weeks, we're going to be talking about something near and dear to our hearts. And that is hospice care. Something that not a lot of people want to talk about or think that they need to talk about until it's kind of too late. So we're really here to say, hey, this is what it is. This is what it looks like. This is what you want to be looking for when it comes to that time for yourself or your loved one. And ultimately what it can teach you about living well right up to the end.
I think, yes. And I think that that's really the thing that working in hospice care, the first thing that it did for me was teach me about living. Yeah. Walking that closely with death changed everything about the way that I live my life.
For sure. It made me a little bit paranoid, to tell you the truth.
We'll try not to pass along the paranoia.
Right. But also it did help me to see, hey, I am so blessed and fortunate to have, the privilege to walk people through this and to get to know their stories and their journey. It's like a really intimate, unique moment.
I was with some friends this week, and we were talking about we were kind of in this conversation about history and just how certain things in history you can actually go and see what happened in history. But what was fascinating as we were talking, I realized there have been so many moments working in hospice where, while I haven't gone and seen history, I've cared for people who have lived that history.
Yeah.
I remember one day I went and saw a patient who at 12 years old had been recruited to build Nazi planes.
Oh my
And they
gosh.
were forced to work for Hitler.
Oh, he was 12 at that time.
12 years old, yeah. He was at 12 years old.
Wow.
That's what they had to do to survive.
That is crazy.
And then I went literally later that night to a patient who had fought in World War II. He was American, and he, at 17 years old, lied about his age to get into the military, went back and forth fighting in World War II, all of World War II.
Oh my gosh.
And he
survived.
And survived until he was
until he was
on
on hospice
now. But I mean, really, to get to have that experience of caring for people with vastly different stories, but both affected by the same part of history, and to hear from them.
Because we're reading about this history in history books. And
exactly.
They're living it, and we get to take care of them.
I mean, what an honor.
Cool. Yeah.
It's really special. It's really, really special. And to be able to really provide dignity and to honor their life during this time is a special thing.
For sure. Anyway, we're looking forward to this season for sure, because we went on a tangent. It's fine. Because we actually met through hospice, and we're both registered nurses, and we've been doing hospice. Oh gosh, how long have you been doing it?
About 5 years.
Okay, I've been at it 6 years, 5 years,
6,
something like that.
7.
Yeah. Oh gosh. Anyway, so yeah, I've really enjoyed it, and I have always said that I feel like I'll probably retire doing it.
We'll see.
We'll see.
You'll do hospice till you're on hospice.
Oh Lord. Hopefully not until I'm 95. Now you're really making me paranoid.
Never retire. Okay, so what was your first experience with hospice? What got you into it? How did you get started? Because I remember one time, one of the places we worked, they would do this intro thing, and they would always ask what got you into hospice?
Yeah.
And I remember he wasn't the owner, but the president or whatever, would always say, people don't plan to go into hospice.
Right.
But then they often get there and never leave.
This is true.
Yeah. So what got you into it? What was your experience?
Okay. So this is so funny because what you're saying, people don't actually plan to get into hospice. I did a clinical rotation when I was in nursing school in hospice, and I was like, never. I will never do this kind of hospice care. It was sad, and it just didn't look like anything I would want to do. So as soon as I graduated from nursing school, I got a job in the ICU. And to my surprise, I didn't code any one of my patients. And it's not because, well, I was able to like detect when death was coming, if that makes sense. And I went and talked to family, like, even if we restart their heart, it's not going to matter. And you don't want your 75-year-old grandma or 99-year-old grandpa, you don't want their ribs to be broken for them to attempt resuscitation with very little success. And so I would encourage my families, like, you want your memories of them to be good. And so I would always flip my almost coding patients to comfort care. And the nurse practitioner that worked, that did hospice in her hospital and did the education, took notice. And she's like, have you ever considered hospice? And I was like, what? No. And then when she explained a little more what it was, I was like, all right, I guess I'll give it a try. And so then I started... Then I got a job, as a heart failure navigator or whatever, and I was looking for jobs not in hospice. But then I applied to this hospice job because they had like a $10,000 sign-on bonus.
You're like, yes,
I was
money.
like, heck yeah.
I can do it for a year.
Yeah, really. And then I fell in love with it. I really did.
That is so cool. I never thought about that, but I also never coded a patient that was one of my patients.
Right.
When I was working in the hospital, sometimes it would take an entire day of conversations, but we'd get them transferred over to hospice.
Yeah, because you were in the ICU too, right?
Yeah. I never put two and two together on that.
Isn't that
That's
crazy?
interesting. That's interesting. But I do think having those conversations, hospice is one of those things that you don't really talk about till you have to talk about it.
Yeah.
And then if you don't have somebody to walk with you through that, because that's a huge mindset shift, to go from do everything to this is the thing we can't control.
Yeah.
All we can choose if we're going to go through this peacefully and with dignity, or if we're going to make it traumatic.
Right. And comfortably, because honestly, death is not kind.
It's not kind, and you need those people on your team to walk with you through it.
Yeah.
So that's really interesting. I think, when I started working, when I became a nurse in 2020, it was like right when the pandemic hit. And our unit turned into kind of the COVID unit. We just had all the COVID patients. And this was back when you didn't have all the DME you needed.
Oh, yeah. So
we were using we had cloth gowns that we just put on and off. Like
the hospital gowns?
Essentially, they were cloth gowns for nurses.
Oh,
that you just put on and off.
That's gross.
In and out of the room.
Okay.
And there was no way to keep it sterile, or no way to make it so you were not just breathing everything in. They got rid of all the paper throwaway gowns. So anyway, that was I was working that unit.
Face right now.
Yes. Now we need to be on video so people can see your face.
I know. All my reactions.
You're like,
they are not censored.
This is not good. People did what they had to do.
They did. COVID was
so
mean.
Yeah, it was not nice. But my first real introduction to hospice was working on that unit, and then so many of those patients were coming in and then just not able to recover. And so they would be switched to comfort care, to that general inpatient status. So I had a lot of inpatient hospice patients there, and that was really my first introduction to it. And then a friend of mine worked for our company and asked if I would be interested in doing parent work for them. And I was like, well, sure. And ended up loving it because I'd seen so many, even the hospice patients in the hospital, it was, one person come in, two people can come in, you can watch through the door. But really to get to help people be where they wanted to be, not away in a hospital, but at home with their family. And to be able to bring more dignity and honor to death was something that was really powerful. And so I just went all in. I was like, this is my thing. But I do think, one thing that stood out to me was that when I was working in the hospital, there wasn't any education.
No.
I was just figuring it out as I went. I had all these patients, and I was a baby nurse. I had all these patients coming in who were, switching over to comfort care, super sick. And then all of a sudden we're going comfort, and it's everything has to change. Your whole mindset has to change. And to be honest, there was nobody to talk me through it. Even in healthcare, people, I don't think, know.
You're right. You're right. Especially when we look as young as we do. I think people are like, I had this encounter with this doctor. I was talking to him about one of his patients, and I said, this was actually fairly recently, and I said, hey, I'm going to go talk to one of your patients about hospice. They're appropriate. And he looks at me, and he looks at my badge, and then he looks at my face, and he's just like, how old are you? I was like, I'm not going to say, but I'm old enough.
That seems like an inappropriate question, sir.
Yeah. He was like, you don't even look like you're barely out of high school. And I'm like, probably a couple decades after that. And so he was just amazed. He's like, how do you have all this wisdom about end of life? And I'm like, well, I mean, I've been doing it for a little while. And it was just so interesting that was kind of his reaction. Like, and then I had another encounter with him, and I was talking to a nurse about like, hey, we need to give some morphine for this patient. They were GIP, so they were in the hospital under hospice care. And I was telling the nurse, because you're not really trained to look at that in the hospital.
No, you're told like not to give it almost.
Right.
Like it's almost like avoid it, give everything else. Like don't use narcotics.
No, right. And so I was like, no, you need to give it like probably every 2 hours. And so she's just kind of like, oh, okay. So the same doctor comes by and he's just like, what? I mean, he just was like baffled. He's like, you're so young. How do you know so much about end of life? You know, it took me until I had gray hairs on my head. He's probably like in his 70s or something. You know, those doctors never retire.
No, it's a lifelong.
No, for real.
Yeah.
Lifelong calling.
Yes.
And so I said, no, yeah, I'm pretty well versed in this. And he was just like shocked. He was like, well, good. I'm glad. But I even had patients who are just like, have you even seen somebody that's no longer living?
Yeah.
And I'm like, yeah. You know, they're just, everybody's just so shocked by it. But I mean, I think especially in like the healthcare, we do need to provide a lot of education because there's a lot of unknown. And I went in to get a revocation form from a patient. All these stories. I went and got a revocation form from a patient, and the ER doctor was like, oh, I think they need to go back on hospice. And he said, I don't really know much about hospice. I'm an ER doctor, and I've been trained to just like help them live, revive them at all costs. Like, exactly. He's like, will you please come in here and talk me through what I'm saying, if it's correct, because you're the expert on end of life. And I was like, it was like, oh, yes, you're right on that. But I too was kind of fumbling through it my first year in hospice care, because you're not ever trained in that. And no one's ever talking about it. And it just seems like it's so taboo in our culture. But I think it needs to be discussed, which is why we're here.
Yes. And I think so often as we go through this podcast, we will kind of talk about specifics of when to know when to get on hospice, and some of the things that you need to think about when you're making that decision. But one of the big things that I see when people are coming on hospice, and probably one of the biggest questions, is what is the difference between palliative care and hospice care? That's like the number one question. That's the question everybody has.
Right.
If I'm like meeting with someone and they have cancer, or they have heart failure, you know, whatever it is, that's their first question.
Everybody, like everybody, including doctors, nurses,
also
families,
yes.
Everybody.
So talk, Carolina, about for a second. How do you explain?
Like
how do you explain this? You're doing a great job. You're doing so
okay,
good.
Thanks.
But seriously, how do you explain this when you're meeting with a family? Yeah. What do you say when somebody says, "What's the difference between palliative and hospice?"
Well, I call palliative care the umbrella, and hospice is under that umbrella. So it's a very specific practice where we really do focus on comfort and end of life. Palliative really only focuses on comfort during a what's the word I'm looking for? Non-curable disease.
Like, I've been diagnosed with cancer, but I'm still going to do chemo. But in order to manage the symptoms, I could qualify for palliative.
Correct. Yeah.
Yes.
Even if you like, well, I mean, obviously, if you're cured of your cancer, you don't need the palliative anymore. But congestive heart failure is a good one too. You know, a lot of people with congestive heart failure, basically as soon as they're diagnosed with that, could qualify for palliative, you know, just because it's like symptom management, try to keep them out of the hospital, which I think is really
Catch
important.
Things early. Yeah. Even, you know, so often people don't even realize like, oh, the weather is going to affect my oxygen, like how I'm breathing. And so patients with COPD, CHF, anything like that can really benefit from palliative while they're doing all their other treatments. Yeah. It doesn't change anything about other treatments.
You have like one specialist basically that is taking care of your symptoms and managing your symptoms, and then you have your other specialists that you still keep that are giving you your chemo or your heart failure meds or whatever. You know what I mean? So like you've got two different specialists that are 3 or however many you need, and then that additional specialist for specifically for comfort,
for the management of symptoms,
which is palliative. But then when you step into hospice, you're like, I don't want those aggressive treatments anymore. I just want to be peaceful.
Exactly.
Whether I have 6 months left or 2 years, you know? That's, I think the benefit of getting on hospice care sooner rather than later is you do get to pretty much extend your life. Little known fact.
It's so true. People think when they sign up for hospice, and I think that this comes from kind of originally when the hospice plan was put out, it was primarily for the last 3-4 days of someone's life.
True, yeah.
That was how it was originally kind of packaged. That's what they would pay for. But then it got extended, and now it kind of fills that gap of, we're having a lot of falls. Nothing's working. The chemo's not working. We're not improving with PTOT. We're needing more and more and more oxygen, and we're having confusion at nighttime. Like some of these things,
lots of hospital stays for not really anything because there's not a whole lot they can do.
Just keep going back and forth to the hospital, and they help for 3-4 days, but then we start to decline again. That's a big one.
That is a big
one. And
one.
Honestly, people wait way too long to have that conversation. Sometimes it's like the 4th hospitalization when the conversation could have been had on the first one.
No, for
and
real.
then it all could have been avoided. And ultimately that helps the patient live longer and have better quality of life, because every time that you're in the hospital, you're losing mobility. You're losing muscle mass at a rapid rate at that age.
Yeah.
In our older adults, you lose so much muscle mass so quickly that
you don't ever return to baseline.
You never do.
No.
And every hospitalization is not helping at that point. It's only putting you further back. There's no rehab you can do once you reach that level of decline. There's no rehab you can do that's going to give it back.
Right.
And so often people lose months of time that they could have had support in the home. They could have had equipment to assist with the decline. They could have prevented falls. And they just spend that time going back and forth to the hospital instead. And it's really sad because there is this great benefit available to them.
I mean, honestly, it's just like one of those things where you're looking at quality of life versus quantity of life. And a lot of times when you do the quantity, you lose. You're like trying to hold on to the number of days that you have, and you're going to the hospital, and you're just losing. But when you're looking at quality of life, your body does a lot better when it's able to rest, when it's able to indulge in the things they want to eat, ironically, and when it's able to be, pain-free. Like your body just does better. And then you have a nurse coming to see you 2 times a week. Catching things early, catching a UTI. Okay, we're calling in an antibiotic. We're good. Get out of the hospital. Stay out of the hospital. I mean,
catching those things early and quickly. And it's not even just the nursing staff. There's with hospice benefit, there's also an aide. There's the chaplain to help with like spiritual and emotional support. There's a medical social worker who can assist with any changes of maybe what was working in terms of caregiving a while ago isn't working. We need to come up with a new plan. All of those things can help us stay home.
Do you want to know something funny?
Yes.
I don't have to know what medical social work does. I always just...
We need to get Tara on here.
I know. I'm always like, your team consists of an RN, sometimes an LPN. You got your home health aide that comes in and helps you with showers and baths and getting you changed. And then you've got your chaplain for emotional, spiritual support. And then the social worker for everything else is what I say.
Oh my gosh, our poor social workers, they have no idea what you've been signing them up for.
Everything. They're signed up for everything. I'm like, you need to be seen by them so they can explain their job better.
So they can tell you what they do. Yeah. So I feel like now this for sure, we need to just make a note in our notes that we need to interview a hospice social worker.
Yeah.
Because obviously I know like when I call them, why I call them, like if somebody's in an environment that they no longer... it's not working for them anymore. We're going to call them to help get placement if they don't have a durable power of attorney or a living will, or if they need to discuss funeral home arrangements, anything like that. We call the social worker. But I feel like we probably don't fully understand what that job entails.
No, I don't think I understand the full scope that they do.
I think we need to talk to them.
I think we should.
Okay, well, we'll do that. We'll have a...
So next week's episode,
we will be interviewing... we'll be interviewing a social worker.
Social worker. Well, maybe not next week.
Maybe not. It will happen.
It will happen.
We'll put it in there. Question. What do you wish more people understood about hospice? Really, truly. Like, what do you wish people, just like people on the street, your general average person.
People on the street.
People on the street.
I just
You're going to walk up to
person
them and be like, I want to tell you about hospice and how it can change your life.
Well, I would say it can be a really amazing experience for loved ones and for the care team, really. Like I said earlier, it's an honor and a privilege to walk people through such an intimate time in their lives. And I think that, just being that companion and being that support system to family and friends, and, the person themselves can be really, really nice. You almost tend to become like family, and
yes, you can't walk through that with somebody and not
right.
I think in some ways, as nurses, it's almost like sometimes we hear a lot about how we change their life. But to be honest, every patient I've had, and it's been hundreds at this point, they've changed my life.
Right, 100%.
It's powerful. It's a powerful time to get you a part of.
Yeah, and I've had, I think about my patients all the time, the ones that I've had in the past, and I'm just like, oh my gosh, like just to have one more conversation with them, you know. So,
and I love hearing from patients and their families, how they're doing. Hearing the hard stuff and the good stuff. And there've certainly been some patients who have wanted to stay in touch. After care and getting those updates on how the family's doing is so good.
It's really nice. Yeah, yeah, it is, because I do tend to become like family.
Yeah, they do, and it's powerful. If somebody was like listening to this and they're almost like having a hard time listening to this because of the fear, even just around the topic, I think there's so much, like we talked about this earlier, but taboo or fear, like you feel like it can be easy to feel like the only way to live or the way to really live is to just never think about death. Put it in a box, close the lid, don't talk about it, and by default, don't talk about hospice, don't talk about quote unquote giving up,
Right.
But ultimately, it's like the one thing that none of us get to avoid. Like it's the one guarantee that we have.
Taxes, death and taxes.
Taxes, that's right. Hey, people still avoid taxes sometimes.
That's true.
People have found ways to get around that, but nobody's found a way to get around death.
That is true. That's a solid point.
And how we think about it affects ultimately how we live our life.
Yes, I think that's true. And even like, just like if you make it a conversation, like a general conversation, I don't think that you're so afraid of it.
Yeah.
Like if you just kind of talk about it like, oh, this is a thing that happens. Like people are born, people live, people pass. It's just part of the continuum of life. And so I think that if you just kind of learn to accept it for what it is, you get to live your life knowing that's going to happen. So live my life today for the full, at its fullest, instead of avoiding it. Because then if you pretend like it's not there, then you pretend like you're invincible, and then not good things happen.
Exactly. Did you ever have a moment when you started working in healthcare and hospice where it really hit you like, this is unavoidable? Did you ever have a moment where you felt like, oh, I need to come to terms with this? Or have you always been very like okay with
I've been pretty okay with death, I think. So it's funny, when I was working in the ICU, my preceptor was like, the first time that you see a dead body, you might cry, and it's okay if you get emotional. And my first week working, I think I saw like 5 dead bodies and nothing. I was just like unfazed by it. I don't know if I'm just a weirdo or what, but it was just kind of like, it just happened. This is just what is, And even when I was younger,
do it. Real conversation.
I know, right? It's raw. I was always interested in cemeteries.
I love walking through cemeteries and seeing
I don't feel
how
so weird.
long. No, like sometimes my husband and I will just go like walk through a cemetery, and I think it's helpful, and not from a morbid thing, but from a place of like, these people have all lived, and they've all been, and they've all done things, and they've all felt feelings, and they've all had the human experience.
Yeah.
And on days when life is really hard, sometimes it's good to remember that it's not hard forever.
Right.
And then on days when life is really good, it's good to know, like, everyone, like, this is the human experience. Like, I'm part of something bigger.
Yeah.
And it can be so easy, I think, in life to reduce everything down to our sphere.
Yeah.
And something about death makes it bigger.
Right.
It takes us out of just our small, tiny, mortal, short 80 years and puts us back into
the longevity of it, really, like
the world, like the galaxies, like the unknown. Like it makes life actually bigger.
Yeah, because I think you're thinking about like, what is it that I'm leaving behind? What's my legacy? What am I passing down?
Yeah.
And for me, even if people forget my name in 100 years, which will probably happen, then it'll happen after 10 years of me being in the grave, let's be honest. But I think that if, my children learn something from me that they take with them and pass it down to their children and their children and their children, like that's just making a difference and leaving a legacy in the world, or, somebody else,
Yeah, so. The generational quality of our life. And then it makes it so much easier to really make decisions because it's what matters. What matters is not who out there knows us. What matters is how our family feels about us, how our family remembers us, what we taught our kids.
Here and now.
They hear it like this moment. Yeah, it's powerful.
For sure.
I think for me, it definitely has changed over the last 5 years. How I think about life and how I live has changed drastically because of working with death. And you get to see people who did life well,
Mhm.
and people who left this world with things unfinished, with things on the table.
I also feel like I see my life or my time as more valuable.
Oh, for sure.
You know what I mean? Like, I have this much time, I'm not going to squander it. Sometimes, life gets better of me, and I'm like, I'm just going to veg on a good
I
episode
need a break.
for 45 minutes, and then I'll get to it,
And then I will get back to life and doing the things. Yes. No, but hey, thank you to our listeners who are sharing a part of their life with us.
Oh, yeah, for sure.
Like, thank you guys for listening.
Thank you for being here. And hopefully this was helpful to you, because as we move through this season, we're going to share some stories from our work, talk about hospice care and what that looks like, how it can be done well, maybe sometimes a little bit of how it cannot be done well. We're going to clear up some myths and misconceptions around end of life, which I think we've kind of started to do a little bit. And then we'll kind of, talk about, like, maybe delve into what other cultures, how they view end of life.
I think that's a big one.
You know?
Yes. I think obviously talking about when hospice might be appropriate and how to start the conversation, how to have the conversation, what to think about, what to look for.
Yeah.
Because so much of the fear in hospice comes from just simply not knowing.
Yeah.
So having those conversations early, and you don't have to be afraid of it.
Well, it's fear of the unknown, right?
It is. And aren't we all?
We want this season to be a conversation, not just a podcast.
Yes.
Right, Rebecca?
Yes. We want to hear from you all. What questions do you have about hospice? What do you want explained? Have you had experiences with hospice? Maybe stories you want to share, or something that happened that you didn't understand? Maybe you had a hospice experience that was even confusing, or you're still trying to understand something. Let us know. Email us. You can message us on all our social platforms, and all that information will be in the podcast description.
That's
so
right.
We want to hear from you.
And if you're enjoying this series, please take a second to like, share, or send it to someone who might need it.
Yes, and be sure to subscribe so you don't miss an episode. Hospice is really one of those things that people don't talk about until they have to, and then they wonder why no one told them sooner.
Yes, so this season is for families, the caregivers, nurses, and anybody else that's curious. We're here to make the hard conversations a little less scary.
So until next time,
stay curious,
ask questions,
keep exploring,
and above all,
be wonderful.
wonderful.